This is the Angel Connect podcast series. In this episode, Targeted and Successful Strategies for Investing in the Healthcare Industry. An interview with Robert Knorr of the Baylor Angel Network by Hall Martin. In this episode of the Angel Connect podcast series, Hall Martin interviews Robert Knorr. He's a director on the board of the Baylor Angel Network, and yes, it is related to Baylor University in Waco, Texas. Now, Mr. Bob Knorr's credentials are quite impressive. He's spent 25 years in the healthcare life sciences area. He's also formed his own medical services company. By the way, he saw a very successful exit after it was acquired, and in addition, he participated in angel investing. And he's also serving on the boards of different firms in the healthcare industry, as well as being an advisor in business strategy. So during this interview with Hall Martin, Mr. Knorr shares with us strategies for finding and pursuing attractive deals with a narrow focus. And also he tells us about his strategy for avoiding the firms that are in a saturated or a congested, what he calls a crowded space. In addition, he shares with us his strategy for addressing possible success offerings with a smaller firm that has a niche for faster development of offerings that would provide a good exit opportunity. And more important, his approach and his core criteria for investing looks more to the strategy of the opportunity, and it goes beyond the management team or the management team's past record. And as you'll hear in this audio episode, he explores the risks, technical risk, financial risk, and as he deals with things like FDA clearance and healthcare reimbursement issues, and he explains how he mitigates that risk. And finally, he shares with us strategies for how he completes successful negotiations that really provide a method of what we call thinking outside the box, especially in discussions dealing with valuation. So here's the interview over the Skype network where Hall Martin discusses investing in the healthcare life sciences area with Robert Knorr. Let's listen in.
Well, hello. Welcome to Angel Connect. I have with me today Bob Knorr of the Baylor Angel Network. Bob, thank you for joining us. Can you tell us a little bit about yourself, Bob?
Sure. Well, I've spent my entire career in healthcare life sciences, and that's close to over 25 years. 20 of that with a large life science company, and about 12 years ago, went out on my own, formed a medical services company, and which was later acquired. And for the last 5 years or so, I've been angel investing and serving on boards of some portfolio companies and doing some general advising, usually in the area of healthcare reimbursement and business strategy.
Well, that's great. So you know quite a bit about the healthcare industry and have been investing and working in that space for a while. Can you tell us about why you invest in particular healthcare deals? What do you look for that gives you reason to pursue them?
Well, the healthcare and life science space is very broad. So I would say, anyone who invests in the space usually has an area of rather narrow focus, or at least I do. So biotech is certainly one area I've got some experience in. But I actually choose not to invest in biotech only because it's a large, crowded space, and my direct experience in that is a little dated. So my recent focus has been in the area of medical devices, and more particularly in medical devices that are geared towards the home, specifically technologies that enable patients to participate in their own care through one means or another.
Are there particular metrics or key criteria you look at for deals in that space, which I assume is telemedicine, home health care, and the like?
Yeah, I like those particular spaces. I think any sort of healthcare play that offers an opportunity to displace traditional healthcare methods or fill some gaps in the traditional healthcare infrastructure are areas that are of interest to me. And part of the reason for that is the company that I formed about a dozen years ago was focused specifically in the area of patient empowerment, enabling individuals to self-monitor drugs and reduce adverse events associated with the drugs that they were taking. So, and this was a way to sort of augment the care that they might otherwise receive, or in some cases not receive, through their traditional methods, either physician offices or hospital outpatient clinics, et cetera. So any sort of technology that sort of fills that gap that exists between traditional healthcare and personalized medicine, for example, are areas that are of a lot of interest to me.
So in a particular deal, or is there something you look at, say they're in the criteria that you're talking about, but what exactly do you look for in a deal that says this is something I'm interested in investing in? If you had to pick one or two items, what stands out as the leading factor?
Well, one thing I shy away from are home run grand slam opportunities. That's quite often the approach that's used by entrepreneurs who believe they've got the next multi-billion-dollar idea. And as exciting and as intriguing that may be, I consider myself more of a single sitter. I'd much rather focus on an idea that has a reasonable chance for success with filling a specific need in a niche within healthcare, as opposed to trying to chase the next multi-billion-dollar blockbuster drug, for example. From my perspective, small is better. And there's some reasons for that, including the less limited competition in smaller deals, and frankly the likelihood of success in exiting through strategic acquisitions to from larger companies, and avoiding coming up with an investment that is the number two or the number three innovation within a particular space. So for me, small is better.
I see. And what else do you look for aside from being small and fairly defined niche that has a clear path? What are the other key criteria you might be looking for?
Well, when I look at opportunity, it's rare to see an opportunity that doesn't talk about $1 billion market potential or total available market. What I'm equally interested in is the accessibility of that opportunity. So it's pretty easy in healthcare to point to any innovation and say that it's got the possibility of $1 billion worldwide or U.S. opportunity. But what I'd like to do is kind of get below the surface and say, okay, well, just how accessible is that opportunity going to be for either the company in question or even the strategic acquirer of that technology when they integrate it into their own organization? Is this something that's going to take 10 years to develop, or is this a technology that can be rapidly penetrated and accessible to even a small company within a relatively short period of time, a couple of years, for example?
Right. So you look for accessibility, the ability to have the entrepreneur engage the technology in the space and turn it into a business. And is there a particular metric you're looking for? They can go to market now, they can go to market next year, or how fast do they need to be able to move on it before you say, yeah, this is probably something in my area?
Well, I think with the healthcare space, I should probably clarify that, in most of the deals that I would be seeing as an angel are pre-FDA clearance. So there are really sort of two parts to the equation. There's what stage is the particular company, how close, what does their regulatory and in some cases their healthcare reimbursement pathway look like? Is this something that's going to require long-term clinical trials or years of working the reimbursement process? So understanding that part of the equation first and assessing the risks, both technical risk and commercial risk of getting to that point. And then the second part of that equation is post-FDA clearance, how long is it going to take to capture a reasonable portion of this of the market? I think as I see deals today, almost all are pre-revenue, pre-FDA clearance, but have a very clear, definable pathway to FDA clearance with a clear understanding of the risk and the dollars and the time associated to get to FDA clearance. I spent a lot of time looking at healthcare reimbursement issues with my former company and some of the companies I've invested in recently, and I always make sure that the pathway is understood and clear, and that the company has sufficient runway to achieve that. And they typically run in the 18 to 24 month time frame. If I've got to look beyond that, lots of bad things can happen in healthcare as a company is on its way to regulatory clearance and reimbursement clearance. So, I'd say 2 years is sort of the out date for me.
Okay. Can you talk about a case of why you passed on a deal? Maybe it was in the sweet spot that you're talking about, but in the end you decided not to pursue it, but maybe it was in the 18 to 24 month window. It was a good single, but why did you pass on it? And without getting too specific, what can kill these deals for you?
The primary one would be a crowded space. So there are certain segments within the healthcare space specifically related to chronic diseases. And I'll just as an example, diabetes is a large problem in the United States and actually worldwide today. And there's some very interesting approaches to improve diabetes care. However, it is a crowded space. Many large companies are investing in that space, both on the drug side, the device side, the service side, and even some mobile health applications. So I've passed on several deals within that space. I've also invested in a couple in that space. But my concern is that, coming up with the second or, investing in a technology that may be the second or third best approach to an otherwise large market like diabetes, for example, raises substantial risk for a company that's third to market, for example. So I passed on actually several deals in that space that were, in my opinion, too crowded for an angel investor to get involved.
I see. Well, that sounds very wise. What is the core criteria for investing once they're in this space and they're in the 18 to 24 month window? What's the final thing that says, yeah, I'm going to go in, or no, I'm not? Is there one turning point that you see from deal to deal?
Well, I hear a lot of angel investors talk about the fact they invest in the management team, and I agree with that. That's important, but that's sometimes difficult to directly assess. What I usually look for is strategy for optimizing the opportunity that's been presented. So sort of after I get past this first hurdle, is this opportunity attractive? Is it accessible within the time frame that I mentioned? What does the strategy look like for optimizing this particular opportunity? Has the company thought through the various risks along the way? What are the mitigations of those risks? What are the funding consequences of those risks? How has the management team anticipated the risks and attempted to mitigate the risk? And what are what is the impact to the investors should any of those risks manifest? I think all of those, a company that has thought out those issues strategically is usually a pretty good indication of the management team themselves, much more so than resumes or what they've done in the past.
Well, that's good. That's interesting. Is you look at management team's ability to strategize and come up with a compelling plan as opposed to what did they do in the past, which is, I guess, a little bit more current version of the management team and what they're doing today on this deal. One of the key issues in working with these deals and investing is the negotiating a valuation once you decide you want to pursue it and it's a good team and so forth. How do you negotiate the valuation itself? Of course, the entrepreneur always proposes something, and the investor always counter-proposes, but what is your strategy for negotiating these deals and trying to come to an agreement?
Well, I mean, you're right. I mean, most negotiations start with the entrepreneur looking for X, you coming in Y, and some sort of meeting in the middle. I tend to not like negotiating like that. Not negotiating where both sides walk away feeling like they've either left money on the table or paid too much for the opportunity. I actually one of the tactics I've used is to hear out the entrepreneur with respect to their valuation point, and to the extent that they've done a good job at determining what that valuation should be, is make every attempt to work with that valuation. However, with the condition that major risks that are inherent in that valuation are subject to milestones. So, for example, an investor or an entrepreneur that may propose that their company is worth $20 million for a particular technology, with the assumption that FDA clearance and reimbursement, healthcare reimbursement will be in place. Rather than attempting to negotiate that person down to, say, $10 million, I'd much rather acknowledge their $20 million valuation, but make that $20 million valuation subject to achieving certain milestones, including FDA clearance or obtaining reimbursement codes or payments through some means. So the objective would be to not negotiate on the valuation per se, but rather the conditions that need to be met in order for that valuation to be achieved. So it's a back and forth, but it's a back and forth based on the risks inherent in that particular deal, as opposed to just getting into horse trading and ending up either walking away or splitting things in the middle.
Yeah, the entrepreneur sometimes seems to have an inflated version of what the company is worth, and if you can tie milestones to what they're proposing so that there's real value to what they're worth, well, then I guess we can come to an agreement between the investor and the entrepreneur that, we can meet on that number, but then they have to achieve what goes behind those numbers as well. So that's a good approach as well to it. So my last question is how do you find good deals out there? There's lots of deals, of course, but how do you find the good ones? What's your favorite source, or where do you see most of the best deals coming from?
Most of mine tend to come through industry contacts. I've been in the healthcare industry for a couple of decades, so I know a lot of people in the relatively narrow space within the healthcare field that I operate, and so it usually, the opportunities usually come up either because individuals have questions, and these are usually introductions through friends or friends of friends, looking for a specific area of advice, which invariably gets into discussions on fundraising, which invariably gets into requests to invest. So I actually like deals sourced through that, because these are referrals usually through people I know or have worked with, and able to assess the quality of the deals based on the individuals who are referring them.
Well, that's great. That's great. So any final words you want to share about investing in the healthcare industry that other people might want to use when they go and look at deals that you're talking about?
Well, I think we're at a unique time in U.S. history. We've got baby boomers who are now, getting into their late 60s, getting into their prime healthcare consumption years. You've got a lot of disposable income amongst these individuals as they retire, and this baby boomer generation retires, and they have a need and desire to be in control of their healthcare needs. So on the one hand, you've got demand for healthcare services increasing. At the same time, you've got the supply of healthcare providers, docs, hospitals, et cetera, that are attempting to keep pace, but are actually being stretched now as a result of healthcare legislation, Affordable Care, which has pulled another an extra tens of millions of people into the system. And you've got this widening gap between supply and demand for healthcare. So I think we can certainly build more hospitals and mint new docs and educate new docs and nurses. But I think any sort of technology that attempts to bridge that widening gap between the demand and supply of healthcare by enabling particularly baby boomers to participate in their own health is a really good play. Baby boomers, just as a demographic group, tend to be very hands-on. They want to be in control of things, and technologies that enable that element of control while at the same time helping to bridge the gap between traditional healthcare methods and services and the need that's required is I think a pretty good bet. So that's where I like to spend my time, and at least so far the investments that we've looked at have played out pretty well.
Well, that's great. Well, that's good advice. The demographics are certainly going into a place where we have to deliver more health care for fewer dollars in a more efficient manner. And so it'll be interesting to see what innovations people come up with to achieve that. Well, I want to thank you, Bob, for joining us on Angel Connect, and hope you can join us again in the future as well.
Thank you very much, Hall. Pleasure.
Great.